Good evening. Thank you for joining us. We're here with the Rio Blanco Herald-Times and our Rio Blanco County Public Health Director, Alice Harvey. Thank you, Alice, for joining us tonight. We're going to do our fourth update. I never thought we would have to do 4 of these when we started this back in February, but here we are. So if you can give us a little update on where we're at with cases and with testing in the county.
Sure, yeah. So we are currently at 6 cases total, all recovered. At this point, we're about 50-50 for cases in Meeker and Rangeley. We do have some new case trend data that we're displaying on our website that I wanted to point out to people, rbc.us, so that you can see more things, more information about our cases like age, symptoms, source if known, etc. And we actually purchased some new data analytics software through COVID funding, so it should get more visually appealing once we start using that. And we, of course, initially had so few cases that a lot of our data was suppressed due to confidentiality issues. But now with more cases, we can show more aggregate data, kind of gives people a better picture of how it's affecting our community. So we'll be displaying that on our website. Testing's taking place all over. We have greatly increased our testing in the last month. So we still have the drive-through clinic at Rangeley District Hospital. We're very lucky to have their full support. They do both private and public health testing available there at Rangeley District Hospital, and all you have to do is call the number on our website to schedule an appointment. In Meeker, you can still get a test at PMC from your physician. They're doing baseline testing of healthcare workers at the wing. We're testing in our jails now. And for everybody else, you can call public health to schedule drive up here at the Fairfield and Meeker anytime. So lots of different options for testing. And just something to note, there's going to be just a few changes moving forward in terms of where you should get tested for certain reasons. So of course, as always, if you're sick, you can definitely go to your doctor and be seen and they'll test you there. But if you're not in need of medical care, but you need a test because of exposure or symptoms, you should come to public health and you can call us. It's free of charge. The only thing that's really changing is with the increase in cases nationwide and statewide, and testing capacity is growing. But if you need an elective screening test, like for travel or for a surgery, that you'll need to go through your private doctor to get. But pretty much every other reason, we can do it here at public health.
Okay. On the testing, it's now, and I know this is happening statewide and nationwide, there's a delay, there's an increased delay in getting the results back. I know for our household, one of us had to get tested and it was a full 6 days before we had results back. And I think that creates some confusion for people. If you're told to get tested because you could have been exposed, what are the right steps to take? What's the protocol for that person? I mean, there was a wait period to get tested, and then there was a waiting period to get the results back. And we weren't really sure, do we lock up? Do we lock up the whole house? What's the right thing to do there?
Yeah, well, and this is not only just a good question, but it's actually a point that I really want to start emphasizing in our public messaging more. So this is a great opportunity to do so. We all know at this point, nationwide, this is a problem, right? Our testing capacity as a nation is not where it needs to be. But although now we have more supplies, which is great. At the beginning, if you remember, we didn't have enough testing supplies. Now we do. Now we're facing challenges with manpower and just lab capacity and volume. So the CDPHE lab, that's the Colorado State lab, has actually really been a leader in the nation. We've had some of the fastest turnaround times as far as state labs go. They drastically increased the number of people working there. They've got whole new shifts added. They have an entire new COVID department devoted strictly to that. So turnaround time was 3 days when we weren't testing a whole lot, but we didn't have the supplies. Now we're looking at 4 to 6. Nationwide, the average is closer to 8 days. And so even private labs are seeing longer delays now. But your question, what does it mean to you? Like if you're exposed, you need to be tested and you're waiting on a test. It's such a good question. And really what I want to emphasize is it's not all about the test. So the test is extremely important because it's the only way we have to track this thing. Mm-hmm. So I think of it like, it's like getting hard evidence that can be brought to trial to convict a criminal, for example. It doesn't mean just because you don't have the evidence it didn't happen, or, it only matters in terms of accuracy and how you deal with the situation. So now that we're testing everyone who's exposed, symptoms or not, it's important to go back to those basics of quarantine and taking precautions. So if you're waiting for a test result, regardless of when they come in, count 14 days from the time you were exposed or 10 days from the time you started having symptoms, if that's the case. Until that date, you need to be extra vigilant. Even if you've had a negative test, I would still tell you to use all the precautions through that 14-day window. Wear a mask, avoid unnecessary social contact, practice good hand hygiene. So obviously, if you have a known exposure, meaning you were a close contact with someone who was positive, you need to get a test, but you can go ahead and do the math and say, all right, I need to take the next 14 days and be extra careful. So the test does a few things for us, though. Of course, the test is so important. What a lot of people don't realize about COVID, what makes it different from things like the flu, is that so often people have no symptoms. This is what makes it more dangerous to society. So since we don't have a vaccine, contact tracing and quarantine and mask wearing is really the only way we have to control it. So the test result gives us that hard data we need to track it down, and then of course guide your care if you're one of the unfortunate ones who get sick. So if you get tested, first of all, you're doing the right thing, because we do need to know if you're positive. But regardless of the result and when that result comes in, because that's out of our control, you can still take some very simple steps. And again, depending on your level of exposure, we can help you make those determinations as to how seriously you need to be about quarantine and isolation.
Okay, that makes sense. That makes, so if it was you're contacting everybody that through contact tracing that may have been exposed, but that may not have been close contact with somebody that is a positive case.
Right. And we're going to prioritize the close contacts, of course. But a lot of what we've seen the last few cases we've had, we had lots of people who we wouldn't have necessarily uncovered, from contact tracing, but people who were just being responsible and knew that they were a potential contact of someone who was a contact of someone. And so we've been testing everybody, everybody who wants a test, which is great, because that's how we're going to track it down. But for all of those folks, we've done around 318 tests in the last month, and we've done 535 overall since the beginning. So that tells you how much we've increased. Out of those tests, we've had 2 that went MIA, and we actually, the lab lost them, whatever, they didn't come back for over a week. And we've really only had a handful that were like greater than 6 days. The majority are that between, about 4 or 5 days. And so it's very unfortunate when you're one of those people. But it shouldn't affect the way that the precautions that you're taking.
And people who are waiting for a test or in that 10-day window or that 14-day window should be watching themselves for symptoms anyway, just like we all should be, and maybe checking temperatures or doing those other things as well as hand hygiene and social distancing and
Absolutely.
that. Okay. So then this question has come up a couple of times. I've seen it on social media. I've had it come up in the office. Are people who test positive, let's say you test positive once, and then you go back in for another test and you test positive again, does that count as 2 positive tests in the case count?
It doesn't, only if it's been, I believe it's 90 days since your previous positive test. And actually that's actually interesting. We still don't know if having COVID, provides immunity, if so, or for how long, if it does. So enough time hasn't passed for us to know it yet. So they're now starting to finally gather data on reinfection rates. So they count a reinfection, meaning a new infection, if it's been at least 90 days from that first positive test. They found you can still shed some of the virus and have a positive test even after your infectious period has ended. So.
Okay. And then on that same line, somebody who does test positive, goes through quarantine, whether they're symptomatic or asymptomatic, do they need to be tested again before they can come out of quarantine, go back to work, go back to their daily life?
No, and actually the CDC for quite some time now has not recommended using a test-based strategy for like a release to go back to work. Really, it's a waste of resources in a lot of ways too, similar to what the previous question. But no, it's that 14 and 10 days. And if you're sick, it's of course a little bit different. We want to make sure you've had no fever for 72 hours, but it doesn't require a negative test, and nor should employers require them, because it isn't practical.
Okay.
Or
Okay.
necessarily beneficial.
Okay, very good. Cases statewide have been on the increase for the last 4 weeks from what I've been reading. And some of our nearby counties, Garfield in particular, have had pretty dramatic spikes in the number of positive cases and are now having to answer to the state and look at ways they can mitigate the, and maybe have to change some things around again. What can we do here to avoid, and we've been very, very fortunate to this point, and there's probably a number of reasons for that. What can we do to avoid getting in that kind of situation that Garfield County is in right now?
That's another great question. There's a couple answers to this, but number one is wear a mask. Maybe probably tired of hearing it, but it's true. And look, the way I like to explain it is just to, back up a moment and don't get kind of bogged down in those details of the masks, and think the whole point of closures, the whole reason any society chooses to close down or shut down, this is around the world, it's all about hospital capacity. Mm-hmm. It's the capacity that we have to care for sick people in our communities. So, this is, if you think of it in terms of that, by anything we can do, even if a lot of people are going to be asymptomatic, so we're not going to be able to use just, hey, stay home if you're sick as a strategy. But if we can wear masks and we can have broader mask usage, and I can talk about that a little bit more about the, efficiency and the efficacy of masks. But if we do that, we can really reduce the risk of, or reduce the amount that the virus is spreading in our communities, therefore reducing the number of people potentially that are going to catch it, that are going to get sick and end up in our hospitals. That's when you're going to see statewide closures again, is when we reach that ICU bed capacity. Another thing to point out, a lot of people like to go, well, but that's in Denver. Why would we worry here? Well, if you're really sick in Meeker, Colorado or Rangeley, Colorado, you're not staying here. Right. You're going to be flown to St. Mary's. If St. Mary's runs out of a bed, you're going to be going to Salt Lake or Denver. Critical care. We have no critical care, our providers in this county. There's only so much. We have, 1 or 2 ventilators countywide that we can sustain, actually realistically care for you if you're that sick. And so ICU bed capacity statewide absolutely has a direct hit or direct relationship to how many people live and die. So that's what the whole idea of closures is about. And so if you start thinking about it like that, wearing a mask is one of the best ways we can stay open.
Okay. How many cases over what span of time? I think we've talked about this before, would represent that kind of increase and be a red flag, be an alarm for public health?
And that's actually something that we've been given an answer to through the Protect Our Neighbor framework, which if you're not familiar with that, that's the next phase we're moving into as a statewide. The next phase will involve each county having their own set of metrics. And instead of having, this is hopefully the solution to having statewide closures, is if we go on a county by county basis, based on how many cases you have in your community and your hospital capacity and what that means for you, that will drive what's going on in the larger community. So for us, it is 7 cases, more than 7 cases in a 2-week period. That's our trigger point. Or 2 or more new COVID hospitalizations on any given day within a 2-week period. So it's 2-part. We could have 7 cases that are asymptomatic. Well, that's great. But if we have more than 2 hospitalizations on a day, that's a trigger point, because our hospitals can only handle so much. So
how close are we to moving into that next phase and we have to get state approval for that as a county?
Yeah, and we're discussing this on Tuesday at the next board meeting, so I have an update. Welcome to listen into that if anybody wants to call in. So I've been working, the application process is pretty extensive. I've been working really closely with our hospitals mainly so far to get some of those metrics nailed down. It involves things like how much PPE do we have on supply, all of those things, testing capacity, contact tracing capacity. So we are in the process of working on that, and I'll be presenting it to the commissioners on Tuesday to gain their approval, and then we'll pursue that through the state of Colorado.
Okay, and if we do get that, what does that change in terms of what we have going on here? What improves?
What improves? Well, what it means is the specific restrictions on certain sectors will just kind of go away. So we won't have this, percent capacity number, which actually right now we're already at a place where most of our businesses and our events are falling under those thresholds anyway in the phase we're currently in, because we were up to, I believe it's 150 people statewide at a gathering. So what will change is we won't have to worry about the specific count capacities for all these different places. They'll still have those guidelines in place. If retail food will still have to keep people distance, so that won't change.
Right.
But we'll be able to have up to 500 people at one event at any time, as long as social distancing is possible. So it really is just kind of lifting all of that safer at home, the specifics, and going back to, as long as you can have no more than 7 cases in a 2-week period, then we can continue the way we are.
Okay. So it really takes it back to just that personal responsibility.
Yeah.
Hence the reason it's called protecting our neighbors, I guess, because we're trying to protect one another.
Right.
So back to on the subject of masks, which we've talked about repeatedly from the beginning, when the CDC and the WHO were saying no masks. If you're healthy, you don't need one. Don't run out and hoard N95s, and all the way up to this week, where now even the president has come out and said, wear a mask, get a mask, wear a mask. This is good. So, I mean, this is a huge pivot that we've seen over the last few months coming from public health authorities and our government. Mm-hmm. What's the latest or the best information that you have on masks from a scientific standpoint to slow the spread of this disease?
That's it. Well, I love talking about this because this is where I can kind of move away from a lot of the political piece of my job and just focus on the data and the science, which, is really what I was trained to do. And so there's a few things I want to share. If you don't mind, I'll share my screen just real quick. I'd like to show you a little video, but before I do that, the CDPHE website actually did a good job with their mask guidance. Can you see that, Nikki? Is that working?
Yep, that's working.
So if you go out to that website, the covid19.colorado.gov, they have a lot of great frequently asked questions on here. Mm-hmm. And at the very bottom, they have a list of some excellent sources. There's quite a lot. So you feel free to look through those. Of course, they're pretty daunting scientific studies, but just in summary, there's overwhelming evidence that wearing face coverings of any kind even drastically reduces the chance that you have of mm-hmm. spreading the virus to someone else. There's also growing mounting evidence that, which this is fairly new, but so significant, that wearing a face covering actually does block some of the, it can reduce the viral load that you get if you're getting it from someone else, and it can reduce the severity of infection even if you do get it from someone. Just by virtue of blocking some of those respiratory droplets. So there's really no argument in the scientific community at this point that masks don't work. They work. They're not perfect. There's nothing that's perfect. But they absolutely help. And I love this visual. I found this on PBS, actually. I'm going to share it just really quickly. This video just kind of shows like how drastic, if you can see, we know now how the virus spreads. We know a lot of people will be asymptomatic, so we won't have the ability necessarily, to see to know that we're infectious. So we're going to walk around and we could be talking, sneezing, and you can see all of those respiratory droplets that just routinely come out of your nose and mouth when you talk. And then you see wearing a mask. It's a mechanical barrier. It's just a physical barrier. So it's very common sense. It goes a long way to protecting those around you. Hence why it's the best chance we have at staying open, having school in the fall, because we know we can reduce the chance that it's going to be spread in our community. And there's one other clip. I love this too. I can't remember what, I think it's at 425. Where this is another one of these really, if you're a person that needs that hands-on example, this guy did an experiment where he kind of sneezed over a petri dish with a mask on and without a mask on. And I mean, it's just remarkable. You can see the difference. Talking alone, of course you've got coughing, but then you have talking and all those different things at the various social distancing. As you can see, it doesn't really matter if you're wearing a mask or not because you're distanced 6 feet. So those are just the kind of things, if you're wanting to look up, I would definitely take a chance to research, and definitely feel free to reach out to us at Public Health too, because we can share some more detailed studies with you as well.
Okay, and answer questions for people that are concerned that wearing a mask, what I have found is that there's kind of a learning curve as far as teaching yourself how to breathe and how to not panic and how to slow down a little bit. So, and I think there's a lot of people that still have concerns about their own personal health conditions and wearing masks. And I think some of those are answered on that CDPHE website. Some of those are responded to as well. So you mentioned schools, and we're heading right back into back to school season. And I know you've been working with the school districts and helping them plan and prepare. At this point, for parents, what do you think? What can parents do to start preparing their kids? And it's going to be a different looking year, I think, for everybody.
For sure. Yeah, no matter what. And I think this is a great opportunity to really, start a dialogue with your kids about, how individual actions can affect your community. It's a great opportunity to explain social responsibility, good citizenship. And so, for example, I've got 4 kids and they're all various ages, and so I've been asking them, just truly think, how much of a sacrifice is it for you to wear, a cool gaiter around your neck, just in the event you have a close interaction with someone or you can't socially distance and you pop it up, versus not getting to see your friends, not getting to play football, having to do online school. I mean, when you frame it that way, it gets them thinking, you're right. This is a small thing I can do. Instead of bringing them into this, political quagmire we're all living in and burdened by as adults, share with them the benefit of living in a small community that isn't afraid, to work together, do what's right, so we can all have some sense of normalcy, and they play a role in that. So, when you explain it to a child like that, it very quickly becomes not so complicated. And I think maybe we could all benefit from doing that once in a while.
Yes. Yeah.
So that would be my advice to parents, and that's what I'm doing with my kids.
Okay. And then any other preparations that parents, like physical preparations, like I think you can buy a thermometer online now again, finally. Things like that, checking for symptoms every day. I mean, are there just real practical things that to start putting into practice?
Absolutely. And I think, I feel very, very lucky to be here. I've been working closely with Chris Selly and Matt Scroggins, so both school districts. And it's just phenomenal. They are trying to come up with the most feasible way to do the best thing for everyone. And truly, the way to think about it, and I would encourage anyone to go on CDPHE website and look at some of that new school guidance that came out, because of course they go into greater detail. But if you think about it like this, if kiddos, fortunately, we know, they're not as likely to get so sick. They actually, younger kids may not even be as likely to spread it. So it's not the end of the world. But if we have a group of kids and there's a positive case in the community, you can see what's happened with some of these positives we've had in our communities where it's touched so many people. So if you can imagine, we'll have a positive case. It'll happen. Well, something will pop up. Somebody's mother or brother or cousin, right, has it. And then this person and then this student. And so if you think about it in terms of who is your child interacting with, and who is your child interacting with not wearing a mask, and when you think about that group of people, that's our sphere where we're going to go test, isolate, quarantine. So if there's a way to do this, it's systematic. Other countries have done it successfully. Some countries have done it terribly. So we're learning from their mistakes. But I do think that in Rio Blanco County here, we have the ability to do this if we're just reasonable, practical. And so I think that's first and foremost, and we're going to be okay.
This is kind of a curveball for you, because talking about kids, what about hand sanitizer for kids?
Yeah, I haven't even really thought about that or talked too much with the schools about that. hand washing is something that is, I think there's probably no other setting that is where hand washing is as important as in a school. So those types of things, of course, are still going to be extremely important, but I would definitely think hand sanitizer will play a role. It has to. It's just an alternative when you just can't physically get everybody to the bathroom to wash their hands with all those little interactions. So
Mhm. Mhm.
and the risks are relatively, low. That's something, I don't know if that's kind of what you're referring to, if anyone's got some concerns. um, we recently received a notification from, I think it was the FDA, regarding certain types of hand sanitizer that could be dangerous, so we keep a very close eye on that, and all the sanitizer that we've vetted in the county is safe for use. And of
Mhm.
course with kids it's a matter of supervision
Right,
and just making sure we're being vigilant. But
right. Just like toothpaste.
right, yeah, or glue. Yeah.
Yeah. So in any other questions or any other things that have come up that you would like to address or share?
No, I would like to just apologize to anyone who, like I said, we've tested over 300 people in the last month. I want to apologize to anyone who's had to wait for test results, but I also want to just thank everybody who's participated in the testing. That is why we have a control here. People just stepping up to the plate, doing what's right. And I also would like everyone to know as well, in terms of mask wearing, just one thing I'll say is it's so easy to be divided, especially on social media and when it comes to politics, and when we talk about individual rights, and those things are all valid, those concerns are all valid. But I really just encourage everyone to come together and think about what we would like to see in the fall here. Really focus on what our end goal is in this county, and that's to get back to as much normalcy as we possibly can to keep people out of the hospital. So if those are our two main goals, we've done that so far, and we've succeeded. People all the time, they're so jealous. They say, I just can't believe you've only had 6 cases. Is that because you're not testing? And I say, no, like, we've tested from day one. We've been able to test everyone who is sick,
Mhm.
at both hospitals, which is, back in March, thank goodness, we've been able to test every contact of every case we've had or every exposure. Um, so we're very fortunate, and I want that to continue. And I believe we can continue that all the way through, maybe even to early 2021 when we have a vaccine. And then we can handle this more like we handle the flu every year, and we can manage it and we can move on. And I think we're finally seeing some light at the end of the tunnel, um, in my opinion. And so this is the time to really, this is not the time to be divided. This is time to just buckle down and do what we got to do to get through this. So.
Yeah, I would agree. Everybody come together, but stick together 6 feet apart.
Yeah, exactly.
Yeah, wearing a mask. All right. Well, thank you so much. Thank you for your expertise and your wisdom and your guidance and your leadership position as public health director for the county. We appreciate it very much. And thank you for taking time with us tonight.
Well, thank you very much. I'll look forward to the next time.
Yep. And someday we'll be able to do this about something fun.
Yes, we will, for
That
sure.
would be nice. All right. Thank you and good night.
Good night.